Now we're going to move to Dr. Jennifer Francesco, uh, uh, Working in Difficult Times. It's a great title. The floor is yours.
Great. Thank you so much, Riyadh. Good morning, afternoon, evening for everyone all around the world. My name is Jennifer DeFrancesco. I'm the Associate Medical Center Director at the Dayton VA Medical Center in Dayton, Ohio, which is a 351-bed hospital. I am a clinical engineer with my bachelor's and master's turned healthcare administrator. I had my doctorate in health administration in 2016. And I have the honor to be with you to talk about clinical engineers working in difficult times from a leadership perspective. So one of the things that was interesting during COVID and during difficult times is I actually was there as a regional director of a clinical engineering program. And then I transitioned back into a role akin to a COO of a hospital. So it's been very interesting over the past year to see both sides of this equation here, and hopefully I can share some things with you all as well as what I've been learning from you on how to continue to navigate these. This is a really transformational time for national healthcare systems, as well as for those of you who don't have a Ministry of Health, private, public, or nonprofit administration or hospitals as well. COVID has really brought to light the good and bad of all of our systems, which is a great thing because you can see the good things that are working, and also a great thing because you can fix the things that may not be working as well. I think some of the things that we can expect as we move forward as clinical engineers and as the healthcare environment as a whole is new policies, economic fallout, and other items to occur for this. So, if you guys have the magic 8 ball, I would love to get a look in it. Right now, we as clinical engineers and as hospital administrators have to do our best in thinking of what's healthcare going to look like in a year from now, 5 years from now, 10 years from now, as we come out of COVID and start thinking a bit more globally about what these emergencies could have in terms of their impact on us. I would say also one of the things I wanted to make sure I worked into here is, sometimes we feel like we have room to breathe. And I think globally we're feeling that way a bit with COVID and the emergency that we're in and getting vaccines out, and we're turning that tide and we're seeing that tangibly with the number of cases we have. But sometimes also I think when we have that room to breathe and kind of process what occurred, we may have this period where we feel almost more tired or kind of take a step back and take that breath. But, the cautionary tale to number one, take care of ourselves and to give us that grace. But also this may be time for clinical engineers to lean in even more. So in terms of skills that clinical engineers should use in difficult times, ingenuity, I think we've seen quite a bit of ingenuity, and you guys have all seen the Hacking COVID that IFMB ECD has been putting out each day. And this is up into leading, we had remote vents at my site where we took the ventilator screen outside to conserve PPE. Also, one of the things I think clinical engineers need to have is, I call them WIs, wild ideas. We are solution-oriented people. We have a wide range of training, and we think of all of these things about what if, and sometimes we have rose-colored glasses with that. But I think if there's any time, 2021 is the year to bring out these wild ideas and solutions. Right now, hospital administrators have a lot of problems on their plate. So clinical engineers being, ingenious and being solution-oriented individuals are what we need. I think foresight as well here. So what are we going to need next? What does healthcare look like in 5 or 10 years? Some of the things that come to the forefront of my mind are wearables. What are wearables going to do, and what are they going to replace in terms of the care that, we can ship someone a wearable and they don't come into our facilities for specific tests. E-health, where are we going to go with e-health, and what are clinical engineers going to be part of with that? In telehealth, one of the big trends we're seeing is, we had people who were hesitant to do telehealth prior to COVID. And now we have people being like, can I just do this on telehealth? You know, do I have to come into the facility if a physician or a provider isn't actually physically going to be touching me for this? Resilience, I think, is just absolutely one of those key things. So clinical engineers working in difficult times, you know, when I was a director of one hospital, I went to bed early, you know, taking care of myself, having a schedule, because you know something is going to be coming up. So, you know, by filling up your cup as much as you can, then you're able to give to others. And that's not only your personal physical health and well-being, but, you know, also your mental health and well-being. Get it doneness. At the end of the day, nothing will replace the sweat equity and some of the elbow grease that you guys, you know, put in. But understanding that, you know, sometimes what got you and made you a successful program may not be what makes you successful in an emergency situation. Growth mindset, I think this is one of the big things that's been a personal lesson, but also a lesson for others during COVID, is sometimes as clinical engineers, we could get stuck. We know the solution. It should be done this way. Why does no one else agree with us? Or why isn't it happening this way? And so we have to think of these changes and challenges in a growth mindset, and think through, you know, maybe there's a different perspective. Maybe there's a different reason. And take it as something that we can learn to expand our skills and to sharpen them. I would say in short, you know, really our world is changing. So your organization might be just barely surviving, you know, the COVID pandemic and these emergency or difficult times, or it may be thriving, you know. So depending on that, you need to see where your organization is, evaluate what's needed by you at this time, and work with your organization hand in hand. Next slide, please. So what do hospital administrators need from clinical engineers? And like I said, the world is changing. You really have to understand your hospital environment and even your national healthcare landscape. When I say, you know, we don't need the same song, old song and dance from you, you know, you might find yourself that, you know, your hospital administrator no longer cares about PMs. They're done. They've always been done. Don't want to hear about it anymore. So maybe they're asking you different questions about capital planning, building resiliency into our programs and plans. You know, do we need to have 200 ventilators? Do we need to have 40 dialysis machines? What might the next pandemic look like, and how do we prepare as best as we can for that? Also proactive problem solving. So again, bringing solutions to the table, you know, and really you understanding emerging trends in health technology that gets the organization there. I say high reliability organization, and this is really the organization as a whole being highly functioning and being able to do the same processes again, really with zero harm to the patient. And this kind of brings in the trends of AI, utilization of data and informatics, access, and ultimately patient outcomes. So when we say your hospital administrator says, I don't care about PMs, tell me how you taking care of this equipment and this equipment being available to our patients actually had an impact on outcomes. So there's a lot of challenges for clinical engineers to really understand that data and how it specifically relates to that. And step up to the plate. You know, I think clinical engineers had the spotlight shined on them in many ways in COVID and this difficult time. And so once we have that opportunity to breathe, you know, some people might want to shrink back, but don't shrink back. You know, some places they may not have put their best foot forward. Maybe they fumbled through the pandemic a bit. Learn from it, grow from it, but do not step back from that plate. Take the swing. Next slide, please. So in terms of a call to action, I would definitely say connect to your C-suite or your executives. And some of this is just knowing, you know, really what's going on in your organization and what they need help with. You know, if we have someone who's a great problem solver, someone who we say, we don't know if this is even clinical engineering, but we're going to, you know, give it to this person because we know they're going to solve this problem for us. So really connect with your C-suite in a meaningful way. Inform yourself. Again, inform yourself of what's going on at your hospital, what's going on in your local area, and what's going on in that larger healthcare environment. So you're going to have to not only know about clinical engineering, but IT and reimbursement and all of those things. So make sure you're constantly learning and understanding that. These two, you know, kind of go together. Sit at the table. So again, don't shrink back. make sure you're sitting at that table and being part of those discussions and those key discussions in your group, and speak up, so make sure you do your homework. And when the organization is going in a direction that you don't think or agree with, make sure you speak up and say why, and kind of do so in a collaborative manner. So I'll leave you, somewhat with this. How do we future-proof clinical engineering? And there's the big global question part of that, and that includes, metaverse and global nomenclature, our international moves for training, certification, and recognition. But also that's a local and personal question. How will you personally work within your organization and your executive leadership on this, and how are clinical engineers helping your organization get through difficult times? We really need to be a team and to adapt. These doors might not magically open, so sometimes you got to keep knocking on that door, and sometimes you have to, go through a window if that's what it takes. So continue that work over time, continue to build upon this, and use the momentum that you gained from COVID and again from these difficult times, and build them into a stronger clinical engineering program and relationship in normal times. So with that, thank you guys, and I think I'll turn it back over to Riyadh.
Thank you. Wonderful, wonderful talk, Jennifer. Thank you.